Hello, everyone. Today I have a very distinguished panel to discuss the issue that I had posed. And the issue is what were the two good and two bad policies that India adopted in its first 20 years, 1947 to 67, that still have an impact today. So it's looking at the past, but it's looking to not the past that has faded away, that still continues to matter. So, in this distinguished panel, we start with Dr. Urvashi Prasad. She's ex-director of the Niti Aayog. And after that, we will have Dr. Ravi Mahamuni. He works for Tata on design research. And then Mathew Varghese, who's a senior retiree from the high levels of the United Nations. Okay, let's go, please. Urvashi, please.
Thank you. So I'll focus today on the health related policies and couple of good things that I think happened in the initial years post independence. Firstly, we did have a committee, the Bhore committee, which gave very extensive recommendations regarding India's health system, many of which hold good even today, like the three-tiered structure that they proposed of primary, secondary, tertiary healthcare, as well as a lot of other recommendations which were subsequently implemented. So that was a good part of that committee's existence and also its findings. But there were a lot of issues in terms of not implementing a lot of the good things as well that they said, which I'll come to in the second part of my comments. So the other aspect I think which was good was that we established the AIIMS in 1956. So we very early established an institute of medical excellence, which even today ranks, amongst the best hospitals in the world. One of the very few Indian hospitals to be in that position. So I think that was something good that we did. And I think we launched some good public health campaigns, whether it was to try and eradicate smallpox or whether it was for malaria. Some of those programs have evolved and continue to run today, like the malaria eradication program, amongst others. So I think those were some of the good things. Um, but I think that it took us 36 years. So in the first 20 years, we did not think of having a national health policy even. And it's less about the policy per se, because every time it's not that you'll have a policy so it'll be implemented, but I think it was more a signaling where we did not prioritize health as we should have, and unfortunately that still holds true today. We have seen marginal increases in allocations when the budgets come on health, on public health. For a country of India's scale, for a country of India's complexity, that is still a drop in the ocean. So I think that deprioritization of health and not really recognizing it as a very critical pillar of not just any society but any economy. And now we want to be developed by 2047. We talk of the demographic dividend, but I think the foundations for those things could have been set much more strongly in the early years itself. Because now we're really struggling to try and play catch up, on public health. So I think that was one of the negatives, where we didn't have high level signaling of why health is so important in those initial years. The other, I think, is, and even the Bhore committee recommended that preventive and curative healthcare should actually be integrated.
Hmm.
They always emphasize that your doctors should also be trained in social sciences in a way. In fact, they said that would help us create social physicians. Today we see a tremendous separation of prevention and cure, of public health and medicine, and that is not something that committee had envisaged, and rightly so. I think we need integration, because today, for the most part, we have a very doctor focused, hospital based, and cure oriented health system. other than a handful of states like Kerala, Tamil Nadu, Maharashtra to some extent, which has a separate public health cadre, we fail to, really prioritize public health as being a distinct field and priority distinct from medicine. So I think that is something that I wish we had done. That recommendation was actually there in that committee. I must say they were very far-sighted, but we didn't quite follow through on that. And also, lastly, I would say that the campaign approach, having everything in campaign mode also has a downside, because now we tend to just look at public health as campaigns. We do this big campaign and then it dies down. We say, okay, everyone should wear masks, and then now nobody is talking about masks in public places. And it's not like COVID is the only, disease that faces us. Similarly, with Swachh Bharat, we had campaigns and missions, and now again, nobody's really talking about it. So I think some of that campaign mode, instead of really looking at health as something systemic, something institutional, something which is a fundamental pillar, that was something that I think was missing in our early years. It's missing, unfortunately, even today to a great extent.
Well, okay, thank you very much. I normally don't want to comment on what anything's been said, but I do want to ask you a question. Uh, the life expectancy has increased. Do you think it has increased enough?
Well, I think, life expectancy, of course, is a complex issue. It's not just a health system issue. It is various other factors as well that certainly come into it. And I don't think that we have progressed at the rate that we should have, perhaps, and that we could have. Also, it's not just about the quantity of life, but the quality of life. And we, just because we are able to prolong life doesn't mean that we're actually giving good quality of life to everybody. And now it's not just senior citizens, because often when I raise these issues, people say, well, if it's the 60 plus population, then it doesn't really affect our demographic dividend, or it doesn't affect our working population. I said, it's young people. It's young people
Mhm.
like me, even younger than me, who are living with very serious physical and mental health issues, and often those caused by our environment, by the pollution factors well beyond an individual's control. So
Mhm.
I think that, of course, quantity of life must go up. And I think, naturally, to some extent, from through various factors, income levels, etc., I think it will go up. But alongside quality of life and the ability of an individual to really be productive and be able to contribute is something that we need to really focus on.
Okay, thank you very much. All right, Dr. Mahamuni, please.
Yeah. So I think it's a very good start by Dr. Urvashi. So I think what I feel is that when we talk about any policies and looking at the context, so I think that if you look at the post independence context where we have a very less resources, whether it's a money or any other thing, expertise and all. So in that context, some of the policy decisions were made, and it has impact. So I don't want to actually categorize into good or bad, but the things like institution building, in spite of having less resources, focus on the institution building, I think was the great. So if we look at from a technology development perspective, setting up the IITs, then the IIMs, or the something like, though we are struggling with food shortage, even that time also we are looking into setting up something like a ISRO or something like that. I think it's a very commendable saying that
Mhm.
yes, I think we have to address the basic issues. But while doing that, as a nation, we should look at the sky and see that maybe in future we will be rising high towards that direction. So I think the balance of basic needs as well as the aspirational needs and having the policies around it, I feel that it's really good and it happened, and we are really fortunate. And I feel that we are sitting here only because of those things which started, especially investing in the education and all. But looking at the population, the question comes is that is it good enough? It's not. But there was a good intention and all. I think it started. So I think the institution building, I felt that it's a very admirable as a India we did at the start, and I think that's where the we made the difference compared to the other nations who got the independence during that time. Second thing is that the checks and balances of all these institutes or all the institutions, I think it's very important factor. I feel that the from democracy perspective, judiciary perspective, and like that. So I think these are the two important things I feel that we have done. And then uh, the additional things what we would have focused, one of the things I think connecting with the healthcare is about the food adulteration, and then the being strict about those things. Okay, so I think that would have been, if we'd have been had a checks and balances early, I think things would have been different now. But I think never late. But I think taking the right policy directions on that will be a great. Another important thing I feel that the though it happened in a recent time is about the right to education and right to food. I think though it came late, would have been come in early part, along with the other investment what we made in, especially in the higher education and the other things, would have changed the overall landscape of our nation. But I think looking at whatever the resources available that time, the priorities and all makes the difference. Another question comes is that the why we really need to look at, like maybe see the 1991 to get liberalized policies. Okay, I think it has its own balances, because if we would have been if we just take the maybe hypothetical situation, and if we would have been the open economy in maybe 1947 and 1948, I think things would have been completely different, because then the government would not have been in a position to decide the priorities. Correct? As a nation, what were, and those institution building would not have happened. I think everything has a right time, and when we look from now and look back and see that, I think that we have to also understand the context, resources available, and all those things. So I feel that as a nation, we have really thrived, and the foundation is there. I think we can really go upwards from this point, and I am really hopeful about it.
Okay, thank you so much, Dr. Babuni. It's your very technical perspective. No comments from me, though, I'll want to comment, but I have been told by my wife, stop talking. So I will stop. Matthew, please.
Thank you, Subhash. First, let me say I've looked at your whippets quite often, and what you are actually doing is democratization of public opinion, so that you put various voices up there for people to see. Hopefully, it will get into the artificial intelligence, and people will capture some of those opinions that are put in here to be useful to the world. It's a public good. So thank you for that, and I'm happy to contribute and say a few words. I really feel humbled in presence of Urvashi and Ravi. I mean, having heard them, let me first say I'm not an India expert at all. I generally, when I was working in the UN, I would stay away from India, anything to do with India, simply because I don't want to appear biased. But that doesn't mean that you don't look at what's happening. Having traveled more than 100 countries, I mean, as a UN staff, and you see what's actually happening, of course, you form opinions. And then now that I'm retired, I can share my opinion on the what you call World Wide Web. So happy to do that. Mm, that said, India is a country which has a lot of pride. And that was something that when I hear Indian diplomats speaking at the UN or anywhere else, I'm like, wow, okay. But at the same time, We also have a habit of blaming everything on our colonial past. Okay? So, um, and what I have to say is that it is true that British looted India. Okay? That was their purpose of colonization. It's not to, no colonization is good. It's okay to fall, but it is not okay not to get up and walk after you fall down. Okay? To blame your fall on somebody else and not get up and walk, we lost many, many years of development. If I see other countries, I'm saying many of them have caught on after colonization. They have moved on. They have prospered. The prosperity has come. India, with its huge, what I call complex and complicated challenges and the hugeness of its size, had not made those what you call developmental moves. One of the greatest problem India had was that it institutionalized corruption. Corruption was a way of life. Red tape was a way of life. With corruption comes you don't allow, you stifle everything. And politics and corruption. It became a way of life, sadly. Okay? And that it continued and still continues to some extent. Some of it has changed, but still, nobody can say India is not a corrupt country today. Okay? And compare it to the best of what we see around the world. However, the best thing that I can think about India is that having seen many other countries collapse and people suffering, it has survived as a democracy, despite the flaws in its democracy. And that's a great thing. However, the greatest today, if you look at it, what you call success story, is that the extreme poverty rate is less than 5%. That's huge. To remove 500 million people from poverty through some very good initiatives and policies, direct transfer, freeing up the economy, infrastructure, digitization, all this has helped. And I suppose, would continue to help, because poverty is something so horrible. But let me also say, I have not seen such level of poverty as I have seen in India. In some of the other poor countries, at the extreme level, and women suffer it, and children suffer it the most. The most important thing that India needs to do is, of course, first, I would say, remove the red tape. Second, even if you go to Indian offices, I have not gone for a few years now, to government offices or the minister's office or Government of India Secretary's office, you see files with red tapes. I don't know whether it has been, it's still there, but I have seen that, and I've asked some of them, you still have these red tapes? And of course, they understand the meaning of it. I was once traveling with what you call official from another European country, and it was interesting that he asked, "Are you the bureaucrat, a very senior IAS officer? Are you the bureaucrat who everybody says is the most corrupt in the world?" To his face, okay? And he basically smiled and tried to justify it on colonization, blah, 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 all those things, okay? And that telling that they are not, all those things. So You have to remove red tape. You have to remove what you call corruption in the country. Then good policies would set in. If those enabling environment is not there, then I don't see what you call the roots of whether it is health, whether it is poverty, whether it is education taking root. Subhash, let me hand it back to you. Thank you for what I said, doing the enabling environment of democratization of public policy opinion. Good job. Thank you. You're on mute.
Yeah, okay. Thank you. All right. Next, we now shift from the speakers to the participants who said we'll listen and ask questions. So, Rujuta, you're next, please. And just introduce yourself.
Yes, thank you for giving me this opportunity. And it was really very informative and inspiring to listen from all these great minds. I'm assistant professor. I'm working in University of the People from as a distance university. If you might have heard about it, it's a tuition-free university for everyone who wants to learn. And I'm acting as an instructor or assistant professor there. Right now, I'm completing my PhD, and in the last leg of my PhD, where my topic is impact of sex education in school curriculum on women's safety and gender development, and which which comes under citizenry development, in my opinion, because what adolescents will learn from now on will be future of our India or the dreams in our India. And that's why while listening to you, I had some questions. Is it okay if I ask? It's not for particularly anyone. Just I wanted to put down this question. Is it okay?
Please go ahead.
Yeah. So as as we are talking about role of non-profits and institutions, which are like a huge part of Indian societal life. What I want to put is we know that optimism about India's future is kind of limited when we talk about corruption, when we talk about so many societal problems. But how can institutions, non-profits, and civil society bridge the gaps left by these policy failures, particularly in case of education and corruption control? So yeah, that was my question.
Question for all the three panelists, whoever wants to go. I am dying to speak, but I will live. I won't speak. All right, let's go ahead. Anyone wants to answer?
I thank you. It's a nice interaction. Am I audible, right?
Yeah.
Yes.
Yeah. I have one question to Urvashi, Prasad. Nice to listen that we have done tremendous progress in health. Okay. But what I feel, that if you look at the two important parameters of the health, okay. First is look at the C-sections delivery in India is happening. Number of C-section delivery by the states. Second one, look at the health infrastructure India we have. Okay, especially the health infrastructure in the sense that the district-wise number of primary hospitals we have, and the number of doctors available per 1,000 population, right? If you go to the states like Odisha, if you go states like Chhattisgarh, if you go states like Jharkhand and all, you have to travel 150 kilometers to get a good hospital, And imagine a condition, a pregnant woman is traveling 150 kilometers to find a good hospital. Now, where is our progress? Where is our progress? And is it a progress? Or is it a progress in some locations, ignored in others? Okay. And then if you like we know that the kind of population growth we had actually 140, 145 approximately 144 crores in India. You know, then we need also, population is nothing but, you need to improve your health infrastructure, right? So now what is happening? The number of doctors available, the facilities available in the hospitals. You have seen incidences in the UP incidences. The children died because of there is no lack of oxygens, right? So I believe that yes, we made a tremendous progress in health, but the I don't think so it is enough improvement we have done. So what I suggest is that we need to have the framework, which clustering framework. I can propose the clustering framework, because each state or each district requires some sort of monitoring authorities, where you know what infrastructure we have in the districts and what actions we are taking for the particular district is the point. The point number two, I would like to say that the state I come from, Telangana, is the highest number of C-section deliveries we have today, the highest number of C-section deliveries. Then this creates a doubt, actually, the biggest doubt, because why we have so many C-section deliveries, right? Are the normal deliveries are not happening, or what? So is it this sector has giving so much of money to some people, or is it because it's a money making industry? Is it a money making industry, or what? So these things government can control, so that it can save some of the people who deserves this. This is my some observations.
Okay, well, thank you so much. You told us the ground reality. Let's have the final speaker. She is a professor in the US and has woken up rather early to be here, because she's towards the west. So, anyway, Professor Kulkarni, go ahead, please.
Thank you so much, Professor Mathur, and I apologize. I was a little late. Yes, it's a little early for me. And uh, I actually, fascinating discussion, and to bring up these issues, which I think have been, not to use a bad word, but chronic in India. My thoughts were, generally, I do feel that corruption is pervasive and is overarching whatever sector you look at. So that needs to be, of course, tackled. But and particularly on health, I was thinking, what I think there was an initiative for public-private partnership, and don't know what has happened. It seems that if you look at empirical reality, it is more moving towards the private, and where is the public part of it? It doesn't seem to be there, in the sense that even those, like recently we had elections in Delhi, and for some people it was a surprise outcome, and for some it was not. So I don't know. The defeat of the Delhi chief minister, who was the chief minister for 10 years, and one of the initiatives that people said that it will be hard for him to lose, is because he has all these health and reaching out to the poor, where who need the most, like he had mohalla clinics and all. But the ground reality was apparently quite different from what he had envisioned, because in all these mohalla clinics there was no medicine, there was no tablet, there were no doctors. So eventually people did resort to going to private hospitals. So that was it was a good idea to have this public private, or even his initiative. Another one which comes to mind, a similar one, is decentralization of healthcare, where I think a lot of, in 1993, this initiative was taken, and a lot of money, I think, was funneled to the lowest units of governance, which is the panchayat system. And again, the idea behind it was noble, and it could have been very efficacious, because these are the people who who are actually the panchayats are the people who get elected by the panchayat leaders, get elected by the people, and so they know them the best. And so, but
don't know what has much happened. And I agree with Urvashi that yes, life expectancy has increased, even though it has not increased that much relative to other countries who started developing around the same time as we did, like South Korea and all comes to mind. I mean, it was almost, they were not colonized for so long, but they also went through a war and which ravished their, it was exactly around the same time, 1947, 48. But but still the quality of life matters more, and maybe it is not, we are not there in terms of quality as we would have liked to be. So those are my few comments.
Okay, well, I think Urvashi Prasad has a lot of comments from the participants, so please go ahead and respond to them.
Yeah, that's good to see. Normally, that's not the case that people are talking about healthcare. So that's good to see. Now, I think firstly, I would say that to I think the second discussant, I think Mr. Jadhav.
Yeah.
Yeah. So I think he somehow, I think, has the impression that I was saying we've done well in health. I was saying quite the opposite. I think we have not done well in health. I was just, I had to find positives, so I
Yeah.
did find some positives.
Yeah.
But I don't think that health is one of the sectors that we are doing adequately at all. And that, I did make that point in different ways. Now, health, as per the constitution, it is a state subject. And I think that is also part of the issue, because a lot of things that the center talks about just remain, frameworks or outlines or, templates that are given to states. But ultimately, every state decides what they want to do, and of course some amount of flexibility in a structure like ours has to be there. But I think certain things are good for everybody, and we do know that, we know that through evidence. So whether it is certain basic nutrition or certain vaccinations or screenings, we know that pretty much everybody should be, getting those done. So I think there, actually, if it could be the center also taking more of an onus, not just in terms of centrally sponsored schemes or, in terms of providing policies or outlines, but actually saying that, yes, we take joint accountability with states to actually get this done. So, in fact, when I was at Niti Aayog, I really tried very hard that, if we can bring health to the concurrent list at least, so that every time the center cannot keep saying that, well, it's a state subject, there's nothing I can do. So I think that is, of course, one aspect which is more constitutional. And, obviously it has complications of politics, etc. But I think, other than that, like was mentioned about the institutional deliveries, certainly, I think there's a huge issue, and of course, that's been documented extensively. The incentives which sometimes get, there's unintended consequences of incentivizing something, and I think we've talked a lot about, C-sections being one of the prominent examples of that, where you gave incentives, you wanted women to have institutional deliveries, but you ended up finding that many women were having them even when they didn't need them. So I think that's definitely a problem still in many parts of the country. But I think generally also the whole public-private relationship in health, I think that is one of the biggest challenges we are facing today. Because the private hospitals, the private system, where, as government, it's really unable to regulate. So it's pretty much out of control. You can give a poor patient a bill of lakhs, and there's nothing that they can do. So I think this whole public private partnership can only happen if the government really has the capacity to also regulate what's going on in your private establishments. Also, very important to remember that private is not just the big corporate hospitals, right? Those might still be easier for government to go and check. But you have to remember that in India, a lot of healthcare is provided by two-bedded, three-bedded, five-bedded nursing homes, small establishments. Now, for any government to go and be checking what's happening in each of those, we don't have that kind of regulatory or governance capacity in the health sector, or even in other sectors for that matter. So I think the whole public private therefore has not quite taken off in the way that it should have. There's also a lot of mistrust that people have, because obviously I'm a public health professional, policy professional, and also a patient myself. So I see a lot of people coming to me for second opinions, and I always ask them that why don't you ask your doctor, why are you asking me? But they said, we don't trust the doctor. What if he's telling us the wrong thing? So we want to know, we want you to tell us. So I see this huge trust deficit in what used to be a very sacrosanct patient doctor relationship, where you really believed in your doctor, trusted them with your life. But now patients, no matter how poor they are, they want to take four opinions, five opinions. So I think we'll have to address this mistrust issue across the system. And I think doctors will have to play a very proactive role in this. A lot of times when I raise it, sometimes, some of the doctors get very reluctant because they feel like, it's an attack on the medical fraternity or something like that, but not really that. We're trying to find solutions. We're trying to say, we've had very unfortunate cases of violence against health workers also. Of course that can never be justified, right, in any situation. But what I'm saying is that there is this growing mistrust, and that could also partly be symptomatic of that, where you feel that the doctor has done something wrong or has not done the best by your patient. So I think those are things which we really need to focus on. And that is why, lastly, I'll just say that recently in the budget, we had this massive expansion of, again, medical education seats. We're really pushing on more and more and more doctors. And I think that's great. That's much needed. But doctors who have the requisite quality, who have the requisite clinical skills as well as
Mhm.
bedside manners. Our older generations, spoke of bedside manners of doctors. So if we're going to churn out doctors like factories, then they cannot have either the clinical skills or the empathy or compassion that is needed in this profession. So I think we need to really bring in the quality element. We need to restore the trust, where we had the family doctor we all trusted in. We need to actually focus on some of those models. And I think government has to take the onus for public health. Private hospitals can come in at your tertiary level, fair enough, but public health, the air we breathe, the food we eat, the microplastics and everything, the water we drink, those are all government responsibilities. At the end of the day, we cannot expect that the private sector is going to come in there unless they can see a profit motive. It's very simple, in terms of how a private organization would think. So government has to take those responsibilities. And I think, finally, sorry, I'm saying a lot of things, but a lot of things were said on health, so I just wanted to finish this. That I think we need to make public health a mass movement. And I'm really pushing for that, because in India, like most things, numbers matter. If I'm going to sit here and say something and it's just going to be me, nobody's going to care. But if we have hundreds and thousands of people demanding something, people will care. Even politicians will have to care, because that's where their votes come from. So health is not, unfortunately, an election issue, for the most part. And even to in Delhi, we had elections, and we were really convincing people that please raise issues of air, and we're breathing poison over here. And non-smokers like me are getting lung cancer. But it's so hard to convince people that this they should be talking about these issues. So I think if we can make it a mass movement, if we can have millions of people out there saying, look, clean our air, clean our food, clean our water, at least do that much. then I think we can really move the needle, but it cannot just be a push. It has to be a pull as well, a strong pull from the population, from the electorate, from the voters who really matter at the end of the day to a politician.
Okay, well, thank you so much for that very clear and inspiring message. Okay, it is both clear and inspiring. So let me, Matthew, Ravi, any comments on anything so far? Any responses?
Ravi, you want to go first? You are
Yeah.
smarter, brighter.
I just want to actually answer the question raised by Professor Rujuta. Sorry. So it's about the role of NGOs and the actually the people working in that area. I think, see, when we talk about the government and all government can do something up to certain level, but if you look at everywhere, the way even the Dr. Urvashi mentioned, is about the trust factor, correct? So I think the people trust these NGOs, the people trust these people who are very close to them. And I think that's where the power and the influence comes into picture. Okay. So a lot of time the people comes to go to those people to solve their problem, though they are not the right people, but they know that if I reach out to these people, they will help me out somehow, and I can believe and trust these people. I think that's where I think this the role of these NGOs, because I'm working with a lot of NGOs for last so many years and having my own also, I think it plays a very important role. The second important thing is that as a human being, okay, there is some goodness in every human being, that I want to help out to others. I really needs to solve others problem. Okay, some have that in a maybe large quantity, some have something is in it. But actually if you look at from the, we call it as the latent intent. Every human being has that latent intent to help others. Somebody's that intent becomes latent for their life, but sometimes that latent intent becomes a stated intent, and the people who make that their latent intent into the stated intent start working in this area, that I want to help other. Okay, and that's why they get involved without worrying about their family life or the money or the effort, time and effort. I think like the Dr. Urvashi is working in that area. So I think like that there are a lot of people working in pockets. Okay, a lot of NGOs are working in pockets, really doing great job. But actually they facing a problem in replicating what the work they are doing, as well as bringing the impact larger. And that's where actually we are trying to help these NGOs through service design methodology, so that they can really make a larger impact, or it's become easy to replicate what the good thing they are doing at the other parts of those things. I think these are the two things I feel that though there will be government initiatives, I think this human innate need of helping others should flourish, so that I think it helps both the sides.
Okay,
Thank you.
Matthew, please.
Subash, just a few thoughts. Again, I'm not an India expert, so I have, but that doesn't mean I don't have opinions, and I may be wrong. The issue is simply that when I'm hearing, we are normalizing things because India is such a huge country, and we believe what we hear and what the politicians talk, etc., etc. I think Urvashi made a very interesting point on more regulations are needed in certain areas. At the same time, I'm looking at the other side. Yes, regulations are necessary, but you cannot regulate social change. Um, because if the more regulations you have, you also have more red tapes, simply because regulations brings in red tapes. What would necessary to change would be a cultural change, and that cultural change cannot come easily because India is a huge country, okay, with set ideas. People thought that corruption is normal. Okay, the ambassador car is a famous example. Is a normal car to have. Okay, and no other country would have a car at the technological level of ambassador. And people would say, to Indian roads, you need an ambassador car. Okay, which is not true. When India was what you call opened up its economy, ambassador car just simply disappeared. But everybody was thinking that ambassador car is the best car in the whole world. Whomever you talk to, okay, at least whom I talk to. So a wholesale cultural change and freeing up, what do you call? India to look at what is happening across the world. And I want to give one last example. When the tsunami happened, we had about $1 billion to give to India. I was at the Red Cross at that time. And India refused to accept the money. Okay? I went to deal with some of them. And China had after many years, China had a huge earthquake. And they were willing to accept any money, anything that was there. So I was asking my colleague, who is Sudanese, and I asked his opinion, why was India behaving like this and why China is behaving like this? And what he told me really opened my eyes. He says China will accept any help because wherever they can learn, they're not sitting in false pride that I know everything. I don't need help. If any help can bring some learning to them, they will accept it. And that actually led them to be able to, interact better with the world. That does not mean that Indian intellectuals are not interacting. There are few who are able to, and that's why you see many of them in the CEO positions across the world. Being brought up in India, but still in CEO very big positions. Some of them are able to do that, but the general public needs a huge cultural change. It's not against regulations. You also need regulations, but you also need a cultural change to go with it. Thank you.
Okay, well, that's I think, a very powerful message that India needs a cultural change. As you know, I'm not going to say anything. It's not my job here to give any comments. So,
but it would be good to hear your opinion.
Let me stay to the end. Let others, the young people, have another shot at it, and let's see what their responses are. Because it's very important that we let the younger generation into the picture. So just to say, Veena Kulkarni is a professor of sociology, not of economics. So she brings that perspective, though I think she studied economics at a younger age, but currently she's professor of sociology. So let's have the younger people speak more. Right, that's a better thing than me speaking all the time. So go ahead.
To me?
Yeah, and you or Rujuta, both of you are very good. So let's hear.
Yeah, because I was not very sure whether I'm the younger one or the older.
No, you are not the younger one. Rujuta is younger. She still hasn't finished her PhD.
Okay. Yeah.
She is a little younger.
So let her go ahead.
Yeah.
Yeah.
Yeah, actually, being younger one in India right now is a little bit with mixed feeling. It's like going through the adolescent again, but with the larger responsibilities is what I feel right now. But on the point about our discussion, because I'm right now I'm completing my PhD and I'm focusing more on education field, where I'm trying to focus attention of the people around the topic of adolescence and adolescent development. I see that there are very fundamental issues that are ground level reality, but they are not reflecting, or they might be reflecting in the policies, but they are not implemented through the policies in context of education or a healthcare sector. And I can see the reality of its impact of failure of policy or failure of implementation and execution in very little examples. Like when I was talking to a student from my survey, and he mentioned that actually there was a percentage that I could calculate, that 97% of the students felt that they're not getting proper education about biology, about sex education, reproductive health education, and this education that is needed to make them proper citizen. And that's where I started thinking that citizenry development is the core issue we can stand right now on, where we are lagging behind, because these people will make the country tomorrow's India. And right now they don't have ethical, or they don't have that kind of framework where they can get a reference from, and they're choosing the wrong resources for their information fulfillment, or to avoid or to reduce their curiosity. Again, this is a very smaller issue when we were talking about so larger issues right now, just right now. But this issue for me is a very endearing, and as well as very important, as this issue will become a huge question for the future generation, where they at that time they will ask us, why didn't you teach us these things? And at that time we will not have any kind of answer, and the societal structure will be quite a piece which we don't want to see. And that's why I wanted to put up that question, that what is the role of us as a citizen, then a social civil society organization, as organization and governing bodies, where they can come together and find some kind of fundamental structure where we can just try to focus more on education and core needs of the human beings. That's it. I might have talked a lot
No, it's
without a
good.
thought, but
It's
yeah,
good.
that's what I
Okay,
wanted
good.
to talk.
Veena, please. Then we can have a response.
Yeah, I mean, I was particularly the point about, again, going back to the health thing about the trust and requiring regulation for the private sector. I do think, yes, Rushi raised a very good point. I mean, we all have that in mind, that that is critical, and how to bring that about. So what has happened is that, as I was saying, that people, gravitating towards private sector is not necessarily because the private sector is something that they trust, but at least it is available, and it seems to be more in control because they pay the money and they get the service, which is not guaranteed in the public health system here. And ironically, I feel that the public health system, the medical professionals are go through a tougher screening process, so they are actually more competent in that way. They go, and also they just by the nature of their job, where they have to look at cater to various kinds of patients, they have more experience, than probably to private sector. So it seems to, it's sad in that sense that, the place where there is really a lot of talent and a lot of rigor is the one which is not able to serve as much as it would like to. So, that and trust, definitely. And this is something where there have been studies which show that there is a trust deficit is very concerning in the sector.
Okay. Anybody else wants to say something? Go ahead, please. Okay. Mathew asked me to give a response. Well, I won't give my opinions. I will try to summarize and link it to the previous panel. I think there's pretty much agreement that India has done well at the top level things, like setting up ISRO, setting up IITs, setting up IIMs, getting a Supreme Court that is independent. These institutions have been pretty well set up. But what the big concern is that at the lower level, things are missing. Okay, we are, as Urvashi has pointed out, public health is not a priority, even though we have AIMS, we have IITs, but the technology is not down to the lower levels. So there is a consensus that, it seems to be a consensus that the good things are at the higher level. but down at the bottom, at the grassroots level, the success isn't there to the same extent. And there are constitutional issues which Urvashi mentioned, that healthcare is a state subject and it's not even a concurrent subject. Same thing in agriculture, it's a state subject, it's not even concurrent subject. I mean, and the panchayats has not yet really functioned that well. So there is an issue of the, even though even the constitutional body, but somebody mentioned that they aren't doing a good job. So we have this problem that we have high level, diplomats who talk well and with a lot of pride, but behind it, there isn't that thing to be showcased. The Mathew mentioned that India has only now 5% extreme poverty, but China has zero long ago. So there, I think we have a sort of a model in which the top does well, and then at the lower levels, it isn't that well. So that's sort of, and the corruption and red tape, they come up again and again in every discussion, that it is holding. Let me just say that professional economists don't take it too seriously that there is corruption. I mean, Mathew has also seen so many countries. I have worked in so many countries which are much more corrupt than India, and yet we have succeeded in delivering results. So it ranks not very high in my list, but that's just my opinion. Yes, in the previous panel, my younger sister, who's a retired IAS officer, she mentioned corruption. She was in the government and she says corruption is an issue. So corruption is an issue which I think comes up again and again. And so that is sort of the summary or the consensus that I see. And the state capacity is also an issue that has come up here also. That what is the role of the NGOs? So the state capacity. And, there's a very dynamic and powerful book by Professor Muralidharan. So I think it runs to 700 pages. The first half of it is how to build state capacity, how to get things done. So I don't know if I'm waiting for some reactions, but I think the point I want to make is that there appears to be a consensus that the state is not capable of doing much more. It was one thing when the needs, and Urvashi, I particularly want your opinion on this, that when the things were not complicated and we were dealing with basics, we had the capacity to deal with it. You mentioned the malaria eradication, the smallpox eradication. So those were fairly not so difficult things, very complex. But as you move up the scale into more complex issues, then the capacity is not there. So let me stop and see what the reactions are.
Yeah, if I may respond to that particular issue, I think we have two issues. One, of course, is complexity, handling more complex situations. Like you said, even in health, we've kind of moved from communicable diseases, although we still have an unfinished agenda on many of those also, like tuberculosis is a big problem. And now with funding cuts and, all kinds of things, COVID, we don't know, what's really going to happen to the whole TB issue. But I think in general, we are seeing this predominance of non-communicable diseases now, which
Yes.
as you say, it is complex. It can be of a higher level where you have to, deal with these issues. But I think that is there. But I think also it is that in a lot of these sectors, health, nutrition, even education, I would say a lot of it is about even doing the basics well, but in the long term. I think continuity of something is also a problem for us. So even distributing IFA tablets, for instance, iron folic acid, which is very simple and which is something very basic, for tackling anemia. But, we do it well in pockets, or we do it well for periods of time. And then, it kind of stops. Sometimes we even have NGOs doing very good work. But then what happens if they move out after 3 years or 5 years? Or the funding priorities of their funders changes, which happens all the time because I've been in a funding organization. So I know that, sometimes after 3 years, 5 years, even your bosses start telling you, find something new, find something new. And I always counter this. I said sometimes it's not about always finding something new, but just doing the basics, the proven interventions well over and over and over again. And it might be boring and might not be so exciting, but ultimately, even in nutrition, what are we coming back to? We are coming back to our home food, right? That's what we're coming back to. We're saying stop eating on, restaurants and food delivery apps and come back to your simple home food. So I think it is an issue of both things, in my opinion. Yes, handling the complexity, but also delivery at scale in a sustained manner is also, I think, a big challenge for, Indian governments.
Okay, let me ask you a question. You mentioned non-communicable diseases. One of them is diabetes, and it is a big, big concern for India because diabetes leads to early heart attacks. Okay, it's just not a diabetes, it's not an illness. Diabetes is a condition that leads to heart attacks and so on. So, do you have any opinions on that? What's happening in India and how it can be done better?
Yeah, diabetes, again, for a lot of Indians, of course, we also do have a bit of a predisposition to a lot of cardiac issues, diabetes as well. But in general, it's, our diets, our sedentary lifestyles, increasingly in urban areas, especially also access to junk foods, being much easier than and also more affordable, at times, than expecting people to, buy fresh fruits and vegetables and, quick cook those at home. So I think it's a complex issue. Overweight, obesity, of course, we've recently had Prime Minister talking about it. But like I said, I come back to my point about the campaign mode and the celebrities. It can work as a one-off. You can do it to galvanize attention, to start the conversation, but addressing it has to be all systemic stuff. And I think, we know what to do to a great extent, but whether it's starting early, it's starting with school children, starting with screening, checking on this, overweight, obesity epidemic, actually, really, that we are facing here in India now. As much as we still have undernutrition, the overweight, obesity is also, becoming a huge issue, and a lot of it is in young people, even in adolescents. So I think we do know to some extent what to do, and a lot of it is there in our, again, in our policies, programs, as we've said, but implementing it is something which is, again, complex, and it needs a lot of stakeholders, because it's not just the government. It needs the private folks as well, the corporates, the food manufacturers, the packaged food, companies. I think it needs everybody, employers. What are they doing for their employees, well-being and wellness, and and making sure they're getting enough breaks and exercise, etc. So I think there's so many factors in this. It's really a lifestyle issue for a lot of people. And but you're right. I think if we don't tackle it, that's what I said. We not only have older people, unfortunately, who are developing it or even losing their lives due to diabetes related complications, but young people, and now, of course, we have social media, so we have frightening videos of people literally just dropping dead with heart attacks in their offices and in all kinds of places. So I think we have to really take this seriously, because like I said, the economy depends on your workforce. And if the workforce is going to be dealing with all this mental health, something that is, again, I would say, a huge, huge epidemic of mental health issues. Cancer is virtually becoming, every other household you will hear of somebody getting cancer. So I think these are things, if we really don't tackle on a war footing, then I think we could be in for, very serious trouble. So I really hope that we can galvanize the public, the masses behind these issues, and getting people to demand that, we want better. As far as, some of these things is concerned, I think I really hope, and, that's at least what I try to work towards in my small way.
Okay, thank you. Dr. Ravi, she mentioned design issues, I think. that the healthcare campaigns are campaigns and they're not designed. Do you have any thoughts on design, how it could work in
Yeah,
NGO or government healthcare?
correct. So I think all the problems today, what we talked about, are the wicked problems actually. If it would not have been a wicked problem, it would have been solved till now. So I think generally for all these wicked problems, actually they are complex and at high scale. And when you solve something, we know about that problem more. I think this is how it goes in that rolling wave perspective. When you solve, you are top, you see little further. You solve it, you see little more further, and that's how you start solving those things. So I think for that there is something called as the system design. I think that system design and the service design mix of that actually really helps to at least start tackling that problem in a more, I will say, progressive fashion, so that we can start solving in all those things. And when we look at this problem, I think a lot of times we just look at the policies or something, but I think we need to look at this problem from the people, policy, and platform perspective. That how we can have the people, how we can enable people, because a lot of things like the what the things we talked about, I think instead of saying that the all education will happen in the school, why can't it start from home itself? Correct. So some of the things like for like that. So when we look at this problem from a people, policy, and the platform perspective, where when I mean platform is that making use of the technology, making use of the latest things so that we can really solve it, and looking at all those things, making it very easy. And that's where this experience design and all those things, we have to look at experience of all involved stakeholders, like the patients, the healthcare provider, the government people, and like that, and not only looking from only one perspective. I think if you try to solve this thing from all this perspective, I feel that there are chances of reducing the impact and moving forward in this direction.
Yeah, okay, that's a very, very helpful intervention because you call these as wicked problems. Wicked is a terminology that many people use these days for very difficult and complex issues. But I think, hopefully we can find some way of getting this design into public policy
Yeah.
formulation for healthcare with the implementation also in mind. Okay. But tell us about how you are actually, you said you're working with a lot of NGOs, there's interest in that. So tell us what you're doing.
Okay. So I work with various NGOs. To what I first do is that I understand what the work they are doing. So we call it as is journey, and then we see that okay, if they want to scale, if they want to replicate, how we can do that. Okay. So let me give one example. So there is a one NGO, we are working with them. So what they are doing is that they work with all the schools where the kids come from the very different background, where they have gone through the childhood traumas and other things. Okay. So there we are trying to see that how we can bring the hope, because if we look at actually in our childhood through storytelling and all, there is a hope building in us that okay, this is how you should aspire for and all. So what they are doing is that in every such schools they are make through the storytelling, through books, they are trying to bring hopes in those children. Okay. So we are trying to see that how we can really design, how we can bring all those involved people together to make it happen. I think that is the one NGO where we are working with them to make it happen. Another thing actually I saw is that I'm working on something called as Mahankur Book Ganga initiative, where when I was visiting some of the rural schools, I found that there is a library class. There is a 60 minutes assigned for a library thing, because it comes as a structure, but there is no library. So there is no extracurricular books for students to read. So how they will get the other thing? So we are also working with them to set up those libraries in the rural area, and that is a mix of old and new books. So there are like if you look at metros and the urban areas, where there are a lot of books at everybody's home, which now they don't require anymore. So I'm trying to collect them which are in a good condition, make them in a good condition, ship it them to the right people, so that we can make them accessible. So like that I'm working with, and the third initiative I'm working with also about the organic farming. I come because I am also farmer, come from that background, rural background. So I am also trying to see that how we can help and encourage farmers to go for organic farming, trying to understand their issues and see that. And there also what they say is that the lot of people come, give the GAN, they just say, and then they disappear. So the what I am trying to do is that I am trying to do it at my farm, trying to establish as a role model. Whatever failure happens will happen with me, and I will say, okay, I have done it. Now you can also do it. I think that's the model I am trying to apply, and where I am working with your brother Ashok Mathur also on that front. That how we can really establish as a role model instead of just having a talk. How we can walk the talk and say that yes, it can happen, and then we can really help others also to grow. I think these are the few initiatives I'm working on and using all my system design, service design type of methodologies to make it happen.
Yeah, it is really an amazing story because you are, I mean, you people would think that this is your full-time job, but you actually have a full-time job.
Yes.
And then also on top of it, he's an adjunct professor at several places. So he's actually working very hard. And, I'm fascinated by the idea that we should get the design into the design of policies in healthcare and education. I think it'll be a very valuable contribution if you can really take
Yes.
some of your initiative, which has not yet been in healthcare, and see to it because as we move to non-communicable diseases, it is not only the doctors who matter. I mean, I defer to Urvashi, but my understanding is that you need exercise, diet, and medication to control diabetes. And if you are going to have this multidimensional issue, then the design becomes very important. And if
Yeah.
you're going to prevent heart attacks to some extent, you need to work on this. So I hope at some point you will find a way to help on that.
So I think I will be happy to work with Dr. Urvashi if there are any opportunities where we can collaborate and see that if we can make a difference on ground. I think nothing like it. I will
Okay,
be
well, that's a
very much
very,
happy to
very
do it.
positive outcome. Matthew, you've been silent. So let me, since you are the senior international expert, you can have the final word.
No, I don't have the final word. Let me first say how wonderful it was to hear Ravi and Urvashi. I mean, I always enjoyed listening to Indian bureaucrats. I mean, Ravi, you're not a bureaucrat, but I mean, the fact of the matter is that out of 1.4 million people, to come out to be a leader in India, you have to be have some level of brains and capability. So I'm accusing you of real intellectual brains. Huh? So sorry about that. I mean, every time I have gone to a what you call to meet a Government of India secretary, we have come out of the meeting and said, "Wow, that really makes sense." That because they know the issues, they know practically, they have their practical. Some of things you may agree and not agree, but you agree with the fact that they have the experience and knowledge to do that. So it is wonderful to listen to both of you from my side. Let me put it that way. Being in senior positions in the World Bank, UN, and the Red Cross for last 30 years, I've been very lucky in that way to be in international civil service, and it is very happy to contribute to this discussion. Thank you so much, and very pleased to listen to both of you.
Okay, well, all right, good. So Matthew won't have the final word. So let me have the final word. I think this has been very helpful, not only to possible viewers, but also to me, to listen to people who are experts in their field and get a sense of where we can go. And also, we can't forget the past. Part of the reason to do this is to give the young people a sense of where we came from. Okay, that in the first 20 years we had difficult problems to solve, and whether we solved them. And the answer is obviously that we solved some of them and we didn't solve some of them. And that I think is, but what I find is that there's no consensus onto what we didn't solve. There's a lot of issues And that's natural because there's a lot of, India is a big country and diverse country, and people have different points of view. And what I plan to do is I have one more session on Sunday. So I will have had, 2 plus 3 plus 3, 8 experts who speak, and me being the ninth. And then I will summarize the positions, good and bad, and try to get it published in an Indian newspaper so that we can leave it as these are the things that people have considered as good, and these are the things that people have considered as bad decisions, which are still resonating. And if they're still resonating, why are we letting those bad decisions resonate today? I mean, that is the aim. That look, they've made perhaps some wrong decisions, like corruption. Okay, corruption was there right from the past. Why is it still there? And somebody may say, well, it isn't there anymore. But what I hear is that it is there, right? And you are not the only one. People are saying it. So the aim is ultimately to be proactive, to identify not the bad decisions that have faded away, but the bad decisions that are still hampering us now. And so that the constraint is removed. Like if we never figured out how to do healthcare properly, why is it that we haven't figured it out now? What can we do to remove it? If we didn't figure out elementary education, what can we do? So what are the priorities? At least there will be some kind of a priority list which we can put forward. So that is my aim. And thank you very much for being here. The logistical steps are that I will process it and upload it, and I will send it to all of you. Then hopefully we can circulate it some more. So let me end here today. But as I never want to have the final word, so I'll give that to Rujuta. She's the youngest. Let's have the final word from you.
Right now, concluding this charcha is what we call in Marathi or Hindi, is a very hard task for me because of the gross complexities involved in this societal subjects. But right now, what I get is inspiration to join the movement, to at least join some part of it where I can actually work on a ground level to do something good for at least one people, as I mentioned just few days back, that if I can do something good in or I can make someone's life better off at least for one person, it will create a change, and that will be the chain of a change, and it will go on, and the society will definitely improve. So with that note, I would be super 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 happy if I can participate and I can do some good in such kind of charchas and also in organizational work, and it would be my honor to work on it. Just as Dr. Ravi said, it would be my great honor to work beside or for anyone, any such organization, any such policy change that will create a difference in anyone's life. So thank you for inviting me in this very informative and robust panel, and that is like really good thing for me. It's really been a great pleasure to listen to you. It's the great and the highest impact of my day today. Thank you so much.
Okay, thank you, everybody. Let's end it here. The recording, but I'll stick around in case anybody wants to talk to me personally. Let's end the recording here. Thank you, everyone. It is such a great pleasure that you have responded and responded so well. Bye, everybody.